living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
In some places, the life expectancy of Native Americans is 20 years shorter than the national average. There are many reasons for this. One reason is their struggle to get adequate care. Today, we'll hear about challenges and how Indian Health Service, tribal health departments, and urban Indian centers work to overcome them. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back. Joining us first this morning is Dorothy Dupree, who recently retired from her position as the Director of the Billings Area Office of Indian Health Service. Thanks so much, Dorothy, for being with us.
It's very much my pleasure. Thank you for inviting me.
So can you talk to us about Indian Health Service? How's it funded? Who does it serve?
Okay, certainly. The Indian Health Service is funded through appropriations from Congress. It's an organization established in 1955 or in the 1950s early. Depends on if you're part of, we're part of the War Department, then we transferred to the Department of Health and Education and Welfare, and then to Public Health Service, and then HHS. So we're embedded, we're one of the sister agencies within the Department of Health and Human Services. We were created to serve federally recognized tribes based upon treaty obligations and treaty rights.
So what services do IHS facilities provide?
We provide all the regular healthcare services at a primary care level. We refer individuals out for any other care that we cannot provide at the local level. And there are a lot of rules for that. It's not an insurance plan, but I can talk about that in a little bit. But we have two budgets. We have the health services budget, which is really the clinical care, the preventive care, the tribal health programs, to funding available for them to take over the Indian Health Service, which they have authority to do under the Indian Self-Determination Education Assistance Act. We also, our second budget is facilities, and it's healthcare facilities construction as well as sanitation facilities construction. Also carried within that is environmental health as well as medical equipment. Mm-hmm. So are the larger medical pieces of equipment that we have in our facilities.
Okay.
So with those two budgets, it complements and provides care for the reservations that we're located on.
What challenges does Indian Health Service face?
Well, the major challenge is underfunding and aging facilities, aging equipment.
What do the facilities do to overcome those challenges? I've been in some of them, and you're absolutely right, they are aged. Mm-hmm. What do they do?
Well, we do have authority as a federal agency to bill another federal agency, which is CMS, the Centers for Medicare and Medicaid Services. So we are the only agency under the Indian Healthcare Improvement Act that has that authority. And we use that income from Medicare, Medicaid, private insurance to supplement the appropriations. In the later years, the most recent years I should say, we've had the Medicaid expansion here in Montana. One of the major differences from other areas that I've been in is that we have such an poverty as well as isolation. So it's very difficult to get individuals enrolled in Medicaid, but we're becoming more and more successful, and I think much more successful because of Medicaid expansion here in Montana. So with that income, we've been able to upgrade a number of our facilities, and I think it was like Christmas. I mean, our providers and our surgeons were so excited because they were getting new equipment coming in, and that is something that they hadn't experienced in a long time. So it brought a lot of energy, not only to our our staff and our providers, but also to our population as they see the facilities being upgraded.
There are a lot of strengths with the Indian Health Service, I know that. Can you talk about some of those unique strengths and why do they exist with the Indian Health Service?
Well, you know, we exist to serve the Native population that have treaties, the federally recognized tribes. And I think much of our success is that we're located on the reservations. And it's through working with tribal leadership where we're authorized to have a facility placed there, and the land we lease from them and so on and so forth. But we also live on the reservations and get to know the people and the customs and interact, and I live among, and I don't know how else to put it, but gaining trust is much of that as well, getting to know the individuals and participating and observing ceremonies and things.
So does the Native American population have unique needs, and assuming that, how are those needs met?
Well, one of the shows that will be shown here is that of our trauma-informed care. And we have high levels of trauma in our population. And anyone who has done any research or study or interest in trauma-informed care, traumatized populations will take note that those same populations have higher instances of illnesses. So we have high rates of cancer, high rates of diabetes, high rates of substance use disorders. So it's very costly. We have glaucoma amongst our population, again, and talking most recently to an oncologist in one of our private sector hospitals who found out what my position was at that time, and as you've known, I'm retired, but he indicated that he was worried because he didn't understand why the Indian population was dying at faster rates. And of course, my response back to him was, it's trauma in our population. And we have to understand and work closer with the trauma. But because we have a greater understanding of the population, we have high success rates. Most recently, we're able to demonstrate high success rates in diabetes, controlling diabetes and increasing our A1 factors.
Oh, that's wonderful. Thank you, Dorothy. Indian Health Service is one part of Native American health and healthcare. We'll pause here for a short break, and up next, we'll learn about another part of IHS, what it is and how it's different. Don't go away.